Dr. Diet is manufactured exclusively for Elken by Medifast Inc., a US-based health management company that has more than 50 years of knowledge and experience in research and development, manufacturing and distribution of health and diet products. Today we have with us the CEO of Medifast Inc., Mr. Brad McDonald. Let's see what he has to say about Medifast. Mr. Brad, can you tell us more about Medifast?
Medifast is the premier medical meal replacement product in the United States. It's been in business since 1980. It's supplied products to over 15,000 physicians, and it is one of the best clinical products in America. It's clinically proven at Johns Hopkins University and also through the National Institute of Health, the Shands teaching hospitals, many clinical studies around the country. Medifast has had terrific clinical results, and we're very proud to have those results.
How does Dr. Diet formulation perform in the U.S., and what do you think of the strengths of the product?
With over 15,000 physicians have had a leading market share. You have to meet the needs of a lot of individual practitioners who are entrepreneurial, who are also very strict in their own medical regimens. And today, we still maintains the leading market share amongst individual physician practitioners throughout the United States.
Quality control is a hot topic nowadays. How do you keep track of quality control process?
It is based on the FDA requirements. We built the whole program around the medical foods quality program set up and inspected by the FDA. We've been inspected numerous times in the past 20 years. We've developed even more intense quality procedures as we developed our business model. We've spent a significant amount of money over the past 2 or 3 years upgrading our plant and facility so that we could maintain superior quality procedures and to ensure that our products are the best available in the medical market.
Dr. Diet is not only produced by a reputable company, but it also has been clinically proven in studies conducted by premier medical institutions in U.S. Johns Hopkins is one of them. The Johns Hopkins Hospital was opened in 1889, which is known for its 114 years of medical excellence, and was awarded the U.S. Best Hospital 2002 by the U.S. News Magazine. The Nobel Prize-winning discovery of restriction enzymes was made at Johns Hopkins. Johns Hopkins has conducted many researches on weight management, and Dr. Diet has always been chosen in treating their patients. Most of the researches were led and conducted by Dr. Lawrence Cheskin. The research has shown on an average male lost 30 kilograms and female lost 21 kilograms over a 16-week period. Dr. Cheskin is a gastroenterologist by training, the founder, director, and professor of the Johns Hopkins Weight Management Center. Dr. Cheskin is the author of the top-selling books Losing Weight for Good, 3 Steps to Weight Loss, and New Hope for People with Weight Problems. He has 15 years of experience in weight loss management. Now we have with us Dr. Lawrence Cheskin. Dr. Cheskin, what are the main types of research you have conducted on Dr. Diet's formulation?
I've been working in the obesity field for the past 15 years. Well, when I first got into this field, it was because America was starting to experience what has now become an epidemic increase in the rate of obesity. And I wanted to start a program at Johns Hopkins that would clinically deal with the problem as well as be involved in research. And Hopkins didn't have such a program at the time. Whenever we do something out of a university clinic, and we want to know that we're doing things that, to the extent possible, have been scientifically tested and formulated. And the first thing that I did was to look at what the results were, and we found that there were pretty good results. This is a field, you have to understand, where efficacy is something that's difficult to come by. It's very difficult for people to make dietary changes and sustain them, so that even if you get a modest proportion of people to make those changes permanently, you're doing well. And indeed, when we looked at the clinics, they were getting good results. This requires a motivated patient, and it requires your attention as the healthcare provider in encouraging and following up with people, but you can achieve very good results with meal replacements, and it can make it easier for people to stick with diets, which is why we've been using them for these 15 years.
As a weight management specialist with 15 years experience, Why do you continuously recommend Dr. Diet formulation?
Well, in the very early days of using very low-calorie diets, there were some problems because the source of protein that was used was of poor quality. It wasn't nutritionally complete. And there were even some deaths very early on in the United States. This is now 20 or 30 years ago. So it is important what the source of protein is, because a lot of dieting is now on a high protein diet and low carbohydrate levels. So the source of the protein is important, that it be of high quality and nutritionally complete. What's also important is that if you're going to replace meals, then you need to make sure that you're replacing not just calories, but the micronutrients, the vitamins and minerals. And you can get a nutritionally complete diet with meal replacements if you take them as directed. We're learning more and more about soy products, and they appear to have some health advantages and health benefits. So when possible, I prefer to use products that have a soy source for at least some of the protein. We feel that it is probably beneficial for cardiovascular health, that it may actually improve one's risk of not having adverse cardiovascular events occur. And of course, people who are obese are already at a high risk. So you want to lose weight, and perhaps using nutritional products in a way that will further reduce your risks. There appears to be some benefit in terms of estrogen levels in women on soy-related products in reducing menopausal symptoms.